Hi, hello everyone. Welcome to Dr. Ravichandra Official. Please like, share, and subscribe Dr. Ravichandra Official for more interesting videos on pathology. Okay, today in this video we will discuss a beautiful topic on WBCs, that is leukemias. If the total WBC count, which is normal 10,000, if it is more than the normal count according to the age and sex, that is more than 10,000 or more than 20,000, then it is most of the times leukemias. And the leukemias, there will be blasts seen in most of the cases. If the WBC count increased in blood, it is leukemias. And if it is in tissues increased, it is called as lymphomas. We have basically four important leukemias. One is acute lymphoblastic leukemia, second is acute myeloid leukemia, third one is chronic myeloid leukemia, and fourth one is chronic lymphoid leukemia. Along with this, we have one more leukemia which is of utmost important for MBBS level, that is hairy cell leukemias. So in this video, we will discuss all these four leukemias. To confirm it as leukemia, the WBC count should be more than 10,000 cells. Okay. It can be 20,000, 25,000, 30,000, 50,000, or 1 lakh or 2 lakhs, whatever it may be. Along with the increased WBC count, if there is blast, that to 20% or more than 20% according to World Health Organization, or if they are 30% or more than 30% blasts in the peripheral smear according to French, American, British classification, then they are considered as acute leukemias. For chronic leukemias, the blast percentage is not the criteria, as there is less than 20% or 30%. Okay. In a child, it's mostly if the blasts are more than 20%, then it is acute lymphoblastic leukemia or ALL. Here, the lymphoblasts are PAS positive, periodic acid skip positive. ALL can be further classified into ALL L1, L2, L3. ALL L1 is having good prognosis and L3 is having worst prognosis. Coming to the AML. AML, if there is more than 20% of the blasts and the person is adult, it is mostly AML. So in AML, the adult will be having blasts more than 20%, and there are characteristic R rods present in the myeloblasts, confirming them as acute myeloid leukemia, and they are myeloperoxidase positive and Sudan black positive. AML is further classified into AML M1, M0, M1, M2, M3, M4, M5, M6, and M7 according to FAB classification. Chloromas are related to AML M2, and the translocation that is happening in AML M2 is translocation 821. AML M3 translocation is 1517. It is associated with disseminated intravascular coagulation, and in the atypical cells, you will appreciate more than one rods, crisscross or rods, and the cell is called as phagoid cell. So AML M3 phagoid cells and disseminated intravascular coagulation is associated 1517 translocation. These are treated with ATRA, all trans retinoic acid, and arsenic trioxide. Coming to the M4, it is showing gum hypertrophy and the translocation is inversion 16. Among the M0 to M7, M2, M3, M4 are having the good prognosis. When there is translocation of 821 or 1517 or inversion 16, there is no need to see for the blast percentage. And AML M7 is acute megakaryocytic leukemia, and it is seen in Down syndrome cases. Coming to CML, chronic myeloid leukemia, it is translocation 922 Philadelphia chromosome, BCR-ABL fusion gene is formed, and here all type of precursor cells are seen in the peripheral smear. That's why this appearance of the peripheral smear is given the name college girl appearance or garden party appearance. Along with the precursor cells, you can appreciate basophils and also eosinophils. CML can be divided into chronic phase, accelerated phase, and blast phase. Chronic phase will have less than 10% of blast. Accelerated phase will have 10 to 19% of the blast, and blast phase will have more than 20% of the blast, and there will be more than 20% of basophils seen in this blast crisis. There may be thrombocytopenia or thrombocytosis in CML cases. Coming to the lab score, leukocyte alkaline phosphatase or neutrophil alkaline phosphatase NAB score, it is low in CML, whereas it is high in leukemia reaction, where the WBC count will be more than 50,000, but there will not be any involvement of Philadelphia chromosome or BCR-ABL fusion gene formation. Coming to CLL, in the CLL, the cells which are mostly seen are immature lymphocytes. There will not be any blasts, they are immature lymphocytes. And on peripheral smears, the immature cells, because of the lack of the vimentin, they will lyse. Lysing of WBC will occur, and these will be seen as smudge cells or basket cells in the peripheral smear, which are the characteristic feature to identify a CLL in a peripheral smear. Bone marrow will not have any smudge cells. Okay. Convent school girl appearance is a characteristic name given as every cell is immature lymphocyte. This CLL is associated with two types of syndromes. One is Evans syndrome and the other is Richter syndrome. Evans syndrome is everything is involved. That is RBCs, WBCs and platelets are involved in this. RBCs will be showing autoimmune hemolytic anemia and WBC is showing chronic lymphocytic leukemia or CLL, and the platelets are showing ITP, idiopathic or immune thrombocytopenic purpura. Coming to the Richter syndrome, it is transformation of CLL or SLL, small lymphocytic lymphoma, into diffuse large B cell lymphoma. This is Richter syndrome. After the AML, ALL, CML and CLL, we have one more leukemia, that is hairy cell leukemia. Hairy cell leukemia is most commonly seen in boys, and there will be massive splenomegaly because of the involvement of red pulp. There will be frequent infections because of Mycobacterium avium complex, and there will be dry tap on bone marrow aspiration, just like aplastic anemia and myelofibrosis. But on bone marrow biopsy, you can appreciate fried egg appearance. The hairy cell leukemias are best seen on phase contrast microscopy, and the mutations involved in hairy cell leukemia are BRAF V600E mutations, and the markers that are positive in hairy cell leukemia are CD11, CD25, CD103, and TRAP positive, tartrate resistant acid phosphatase positive, and the marker annexin A1 is characteristic of hairy cell leukemia. DBA44 is also positive. Thank you for your patient listening. Please like, share, and subscribe Dr. Ravichandra Official for more and more interesting videos on pathology.